When someone finds out that they're diabetic or pre-diabetic, it can be overwhelming. You're hit with new terms, pamphlets, information. You don't know where to start. So in this video, I'm going to share 3 things that help my patients reverse diabetes within 3 months. Hi, I'm Dr. Dawn, board certified family nurse practitioner specializing in chronic comorbid conditions with high mortality. That simply means that I help patients that have the most prevalent chronic conditions that, when combined, have the highest risk of causing death. When I have patients who are newly diagnosed with diabetes or pre-diabetes, the most frequent response is, I didn't feel anything. I had no idea. I feel the same. And so what I usually tell those patients is, that is the way it's supposed to be. You're not supposed to feel anything. God gave us these amazing bodies, in that the body is able to compensate for decades. Without having annual labs or screening tests, people can go years and years, 10, 20, 30 years without realizing that they have a condition. Most people have already had 10, 20, or 30 years worth of damage done to their body by the time they feel it. So that's why it's so important for us to have annual labs in order to diagnose these conditions before they get out of control. The amazing thing is that God made our body so that we have a lot of time to correct a situation. So when you get your annual labs and you catch it early, you can stop the damage before it starts. So for those people who have diabetes and may have had amputation or dialysis or suffered a heart attack or stroke and they're diabetic, when that happens, for most patients, that means that they've already had the condition uncontrolled for decades, at least 10, 20, or 30 years. When patients get down on themselves for having diabetes or pre-diabetes or any chronic condition, I encourage them that they should feel positive about it, because at least they came in for their annual exams in order to know that they have the disease. Whereas in previous generations, and before things like the Affordable Care Act, what some people call Obamacare, people weren't able to go to the doctor and have a regular primary care provider. So now we have the means to have a primary care provider and get in and be seen and have those preventative tests done. So before we get into the 3 things that can reverse diabetes or pre-diabetes in 3 months, I'm going to give a little background information and education. If you want to fast forward to the part with the information about the 3 things, I'll have a timestamp in the comments for you to fast forward to that part. But first, let's talk about what does it mean to reverse diabetes. So when a provider says someone is reversing diabetes, it simply means that you're bringing your numbers back to normal values. In order for diabetes to be diagnosed, providers look at a number called the A1C. It's actually called the hemoglobin A1C, which stands for glycated or glycosylated hemoglobin. What is hemoglobin? Hemoglobin is a component of our red blood cells, and A1C can be performed every 3 months. I've had patients ask why they have to wait 3 months in order to have another test done. They made diet changes and it's been a few weeks and they want to see how those diet changes are doing as far as their lab values. However, the hemoglobin in the hemoglobin A1C means that it is looking at our red blood cells in order to give us the value. Red blood cells are only regenerated every 3 months. And so in order to have an accurate value for the A1C, that's why it's needed to wait at least 3 months before having another test done. So in order to say a patient has reversed or is reversing diabetes, we look at the A1C, and the values for the A1C range anywhere between the 4s to around 15 or 16. They do go higher than that, but usually when you get above 14, 15, 16, that means you're in the hospital. So when the value is above 16, we usually don't see that in primary care. The person usually is hospitalized. Okay, so a normal A1C would be for the number to be less than 5.7. Optimally, we would like the number to be in the 4s or low 5s, between 4.8 and 5.2, so that you're out of the danger zone of being pre-diabetic. Pre-diabetes starts at 5.7. Between 5.7 and 6.4 is pre-diabetes. 4, so 6.5 and higher you're officially a diabetic. Greater than 8, then you're in the danger zone. So to be clear, when providers say reverse diabetes, it does not mean that you're getting rid of diabetes. Once you're actually a diabetic, always a diabetic. So even if your numbers come back to normal, you'll still always be considered a diabetic. The pre-diabetic label does not remain, but it's always good to let providers know that you've had a diagnosis of prediabetes in the past, even if you improve the numbers. When the A1C gets to be greater than 8, that is when you're really in a danger zone, putting yourself at risk for hospitalization and complications. When the A1C is 10, 11, 12, you're taking a major risk. If you are diabetic, the goal is to keep your A1C 7 or less than 7. So just to review, all it means when someone says reversing diabetes, that means that you took your numbers from the higher ranges of 10, 11, 12, 15, and you're bringing it back down to normal. Why is it important that our community is talking about diabetes? The numbers for diabetes has skyrocketed over the last few decades. Diabetes actually threatens to bankrupt our healthcare system if we don't start seeing improvement in numbers. This is one very important statistic that I like to share with patients. 1 in 3 people are pre-diabetic, and 80% of them don't know it.
Let me repeat that. 1 in 3 people are pre-diabetic, and 80% of them don't even know it.
That's why it's vitally important to go in to have your annual lab. 33% of adults 65 and older are diagnosed with diabetes. 15 to 17% of adults 18 and older are diagnosed with diabetes. Diabetes is a long-term chronic illness, and the reason that it threatens to bankrupt our healthcare system is because people can live many years with diabetes. When the diabetes is uncontrolled, that's when they have the complications that require frequent hospitalizations and procedures. So just to review, most people can't see or feel when they have prediabetes or diabetes. So that's why it's important for us to go in to have our annual exams, get our full panel of labs done, and to screen and figure out if we have any of these conditions. So now it's time for the 3 tips. In these videos, I will just be sharing things that work for my patients. Remember, I'm a provider, but I'm not your provider. So before making any changes to your treatment plan, you should speak to your provider. Okay, so the first tip is to stop eating by 6 p.m. The timing of meals is much more important than most people realize. The simple way to explain it is that eating after 6 p.m. causes spikes in blood sugars. The more complex way to explain it is vital to understanding how simple decisions that we make each day affect our health. For the more complex way to explain it, I'm going to do a separate video about the different hormones in our body and how they affect our health. But for today's video, I'll just leave you with a recent example of a patient who was affected by eating after 6 p.m. This particular patient had been living with pre-diabetes for many, many years. At the time that I met the patient, it had only been a few months since I knew her, but I could go back into her history and see that she had A1Cs that were 5.8, 5.7, 5.9 for many, many years. When I saw her in April, she went from being a pre-diabetic to a full-blown diabetic. She went from an A1C of 5.8 or 5.9, and when she came to see me in April, her A1C was 7.2. So now she's gone from being a pre-diabetic to a diabetic. When I saw her that January, we briefly talked about diet changes and what she needed to do to get out of being pre-diabetic. So when I saw her in April, I was shocked that she was a full-blown diabetic. And so we talked about what she had been doing for the last few months, the diet changes, and she was shocked that she was a diabetic because she said that she was eating much better than she had been all those previous years. She didn't understand why she had the spike and was now a diabetic. So after asking numerous questions, we finally got down to the reason, and what it was is that she started a fast with her church. And so with this particular fast, it was similar to Ramadan in that she could not eat while the sun was up. She had to eat before dawn or after sunset. So she was eating once a day around 8 or 9 p.m. When she ate, she didn't eat a huge meal. She said that she was eating some type of meal replacement shake, and that's all that she would have. And then sometimes she would have like a small piece of bread. But just from that simple change, she was barely eating. But because that one meal that she had was after 6 p.m., that sent this woman from being pre-diabetic to diabetic. Now, needless to say, we talked about the diet changes that she needed to make. And then when I saw her again that summer, her numbers were no longer in the diabetic range. She went back down to like 5.8 or 5.7 for her A1C. But now, since she had that one value that was diabetes, the 7.2, she will always be considered a diabetic. Now, even though someone is always considered a diabetic, that's just a title. The most important thing are the numbers. So by her bringing her numbers back down to a pre-diabetic range, she's not doing that long-term damage to her body. Okay, so tip number two. Tip number two is to have some type of fiber-rich food first thing in the morning on an empty stomach. So I usually tell patients to either eat oatmeal first thing in the morning for breakfast, or if you're busy and don't have time to make oatmeal, I usually encourage patients to buy a bag of flaxseed, ground flaxseed, mix it with water, shake it up. You can put it in a water bottle, shake it up and drink that as your breakfast. Now with flaxseed, it is very heavy, so it tends to float to the bottom. So when I tell patients, if they say they want to do the flaxseed, I always try to warn them to shake it up every time they drink it, so that when they drink, they're not just getting water, that they're getting the flaxseed as well. But I've had some patients who get excited about making the diet changes and they do the overnight oat. They find low glycemic recipes using probably strawberries, blueberries, and like a little bit of honey. They do the overnight oats. They prepare it for a whole week, and then they just eat that each morning, bring it with them to work and eat that for breakfast in the morning. So the importance of fiber is that it helps to stabilize your blood sugar throughout the day. Diabetes affects us because we're having the spike up and down of our blood sugar. The fiber helps to stabilize the blood sugar all day long. I have had some patients, when they hear the word fiber, they say they're going to do Metamucil. The patients who opt to do things like Metamucil, I don't see the results of the blood sugar coming down, of the A1C reducing. So for my patients, the most success I've seen is them doing the flaxseed or the oatmeal. So the fiber helps to stabilize the blood sugar throughout the day, and then it also helps to cut the appetite as well. So then you're not as hungry throughout the day. Tip number 3 is the most obvious one, but it's also the most difficult for most people. Tip number 3. You gotta cut out any obvious forms of sugar. So because this is just the beginning, I usually don't overwhelm people by talking about complex carbs like bread and rice and all that. The first couple weeks, you just want to get acclimated to it. So I just tell them to cut out any obvious forms of sugar. So that means no juices, no soda, cold drinks, cut that out. You have to cut out the honey buns, the sugary cakes, the Little Debbie snack, all those type of things that are obviously filled with sugar, cut those out. So if someone likes to drink coffee in the morning, try to do black coffee. Or if you absolutely have to have sugar, try to do some type of sugar substitute. Like for my patients who are people who drink a lot of soda, cold drinks, I usually tell them to switch to water with lemon. And if they absolutely need sugar, then do some type of sugar substitute like a Splenda. Optimally, you wouldn't have any sugar substitute because there are studies that show that affects the numbers as well. But once again, we're just trying to get started. So if that's what you need to get started, that's okay. That's what I usually tell my patients. So just to review, I just want to encourage you, if you're a person who has diabetes or pre-diabetes, whether you just found out about your diagnosis or you've been having it for years, please don't get down on yourself. Feel encouraged that you did not wait until you felt something wrong to go to the doctor. Please be encouraged that you're not someone who ended up in the hospital. My background is in ICU, so I had many patients who didn't find out that they had diabetes until they ended up in the ICU. And their family is always shocked, saying, they were walking around fine, nothing was wrong. But that's the way the body is. The body will compensate until it just can't do it anymore. And so that usually happens many, many years after the person has had the disease. So be encouraged. Be proud of yourself that you went in, that you had your annual exam, that you know your diagnosis, and now you can do something about it. Some other additional advice I usually give my patients is to take your time. Be easy with yourself. Try to do one new change each week. Try to do one new change each week. If you are a person who is an uncontrolled diabetic, I would just like to give you some encouragement that it is possible to bring your numbers back down to normal. This year alone, I've seen 2 major success stories from 2 of my patients. One patient was a newly diagnosed diabetic. It had been less than a year since he had the diabetes diagnosis. The other patient was a diabetic for many, many years, uncontrolled. So her blood sugars were 11, 12, at least 10 for several years. That particular patient who had been diabetic for several years, this year she decided to take her health more seriously and made diet changes. And within the course of 6 months, her A1C went from 12.6 to 6.1. So she went from being a diabetic who was at risk for hospitalization at any moment. The first 3 months when she came back for her A1C, her number was in the 8s, maybe the high 7s. And then when she came back 3 months after that, her number was 6.1. The other guy, he was a person who diabetes ran in his family. He was a pretty young guy, early 30s. His diagnosis came when his A1C was 10.6. But he had all the risk factors for diabetes. He had the acanthosis nigricans, which is the darkness around the neck. I'll talk about that in a later video. He was overweight, and then he also had the family history of diabetes. So when I saw him, the new diagnosis was 10.6. The first 3 months, I don't think he took the diagnosis too seriously. He took the medications, but he did not make any diet changes. I always tell patients, in order to see improvement, you have to help the medication work for you. You have to make diet changes. So the first 3 months he took medication, but he did not make any diet changes, and his number pretty much stayed the same. After that, we had talked again, and he was encouraged to make the changes that he needed to make. So then when he came back 3 months later, his numbers were in the 8s as well. So he went from 10.6 to 8 something. And then when he came back 3 months after that one, that's when his number was 5.8. And he's actually been able to completely come off of medication. He was able to completely come off of medication, which is amazing. So for those people who have been diabetic for several years, who A1Cs have been 9, 8, 9, 10, 11, 12, and you feel discouraged, I just want to encourage with these patient success stories where you can see improvement and change and come back down to normal levels by just making some diet changes. And they didn't do the diet changes all in 1 week. That's what happens. Sometimes we get overwhelmed and then we think we have to do everything all at one time. And then when we can't do it, we get discouraged and just go back to old habits. So once again, that's why I always encourage patients to do one change each week. You can even do one change a month, just whatever change that I tell the patients they want to make, just be consistent with that change. And if you have a good provider, he or she may ask you to come back into the clinic every 2 weeks in the beginning, just so that you can get a handle on it and figure out a regimen that works best for you. Good providers will ask you questions about your diet to find out what diet changes can work for you. So if your provider asks you to come in every 2 weeks, make time in the beginning. I hope this information helps. Y'all have a blessed day.